Upper cervical NUCCA adjustments for the treatment of chronic fatigue syndrome. This characterization of the correction of atlas misalignment in chronic fatigue syndrome volunteers and the improvement in their condition when maintaining alignment. A review of the work conducted by me, Dr. Marshall Dickholtz Sr., Dr. Leo Jacobs, a psychiatrist, and Dr. Bruce Bell. This work was done about 8 or 9 years ago. It hasn't been published yet, but we want to show you what's going to be published, and we're all over the world looking for help for chronic fatigue syndrome. We got tremendous results. It's going to be published in the very, very near future, but here's some statistics. Also, what we're trying to show you, all these different diseases have a correlation to the brainstem. Here's one of the chronic fatigue cases where I had an atlas laterality, and if you can see, it's 93.25 degrees on one side, 89.1. This was off 3/4 of a degree to where the atlas is balanced in the head at 90 degrees or 100%. Now over here, we only reduced it a half a degree, and the patient responded. And a half a degree is about a little bit more than a fifth of a millimeter. That's what we're talking about, some very, very small measurements. And notice how sharp our x-rays are. You have to have sharp x-rays and understand magnification in the x-ray field and x-ray alignment, and that way you can measure the x-rays to this degree. There's a couple of famous doctors that did chronic fatigue syndrome, and there's Dr. Buchwald, Dr. Krameroff, and I think they're in New York, and then the research we did on ours. And notice we have 3 charts here on chronic fatigue syndrome on the 8 functions of the RAND 36 study. Physical functioning, role of physical, bodily pain, general health, vitality, social functioning, role emotional, mental health. All right, this is the national average in the United States. 100% is up here. A medical doctor looked at that and told me, he says, well, it shows you the average health in the United States is not that great. All right, that's all the chronic, that, by the way, this was, actually, we'll call this 20 cases on chronic fatigue syndrome. Each one had $5,000 worth of medical tests at a Good Shepherd Hospital in Barrington, Illinois. And we'll show you what became of that. This is 20 cases. We started out with 20. One dropped out right away. And in 3 months' time, see how their health improved. 6 months' time, see how their health improved. All right, this national health in the United States. 10 out of 19 of these patients only got one adjustment in 6 months. Get that, 10 out of 19 only got one adjustment in 6 months. In other words, they were instructed how to protect their adjustment, but when the neck is balanced in the head, this is the potential. And what do you mean when you say holding an adjustment? How do you, we did check them first on weekly visits and then semi-weekly visits. When a patient is holding their adjustment, on bilateral temperature, the base of your skull should be the same. When they're laying down, the legs should be even. When they're turned their head, the legs should not change in length. When they're standing up, the hips have got to be level to maybe a half a degree, less than 1/8 of an inch. And the shoulders should not be tilted more than 2 degrees. There's a little leeway in the shoulders not weight bearing. So when they're holding adjustment, there should be no twist in the shoulders, no twist in the hips of any great degree, which we'll cover this in a little later. Now, after we took one case out of here, they showed it's still more improvement on chronic fatigue. All right, the absolute gains, this is the gains they had percentage-wise in the 8 functions. 100% gains, 56 gain. This, by the way, Dale Johnson did this at Life University in West and Hayward, California. Pittsburgh Sleep Index, another research instrument. Subjective sleep quality, sleep latency, sleep duration, sleep efficiency, sleep disturbance, sleep medications, daytime functionings. Look how they improved. End of the 6 months. This is the improvement, the end of 6 months of their health on the Pittsburgh Sleep Index study, on the chronic fatigue syndrome. Clinical blood tests. They couldn't find anything wrong with these patients, including a SPET scan. That's a radioactive isotope into your blood to see if how the blood circulation is around the brain in total. And there's really no changes in that. But look at this. AM and PM cortisol levels went down to normal. That's a stress hormone that showed that chiropractic, and that's a research project all by itself. And I've seen this change in menstrual periods. When after you adjust a young female, you tell them they may have a change in their menstrual periods so that they don't think they're pregnant.